Welcome to another episode of Dr. G at the Heart of Healthcare. We are just still going along in season 4, and today we're going to talk about when is it time to switch health insurance. We have a special guest here, Kristine Swisher, who is a returning guest. She was here with us on National Healthcare Decisions Day 2024 when we had the interdisciplinary panel, and she's back to give us more information and her expertise. Welcome.
Thanks, Dr. G. Thank you for having me. Very privileged and honored to talk about such a topic that's very near and dear to my heart. I am a Medicare and long-term care insurance specialist, and it really started when I had to help my loved ones in my family and other people make some medical decisions. I have really always been exposed to this because of my husband, who treats people in assisted livings and in their homes. And getting to meet with different families has truly allowed me to have so much just background knowledge and information about that. And yeah, I'm a mom with 2 kids, and I'm also an adult caregiver to my mom as well.
Well, like many people in the sandwich generation, you're doing great work out there, taking care of the community, and taking care of your family. So thanks for giving us that quick bio. It's always fun to see you at the Peace of Mind networking group. Shout out to Gabrielle Pumpion. And we always get together in San Diego to put our minds together and our hearts together to provide solutions. So let's just jump in because I'm so happy I have you to myself this time. Last time it was like 40 people here. Let's just focus on insurance. So I have a story, it's kind of a conglomerate. My audience may or may not know, I often help in the community where a senior may be moving into an assisted living or a memory care, and they need a form filled out in California called a 602. If you think about it, it's kind of like, your kids do sports, right? Like
Mhm.
when people get on a sports team, they have to have a paper filled out. Well, seniors have to have paper filled out before they move into an assisted living or memory care, or other RCFE like a boarding care. And so often I'm just consulted to do that for them. And then the other scenario is when they move in there, those communities are not allowed to provide any medical care without a doctor's order. So when I do their admission paperwork, I often have to order, maybe a 30-day supply of their medications. I sign sometimes standing orders for a Tylenol, a Band-Aid, um, you know, just easy stuff like diarrhea medications or things like that. But I am deferring to their primary care doctor. And so that's kind of where I leave it. But sometimes the community calls me because they think I'm their doctor. And the family has not, retained me as their doctor. And then the senior's in limbo. And so I wanted to kind of learn more about that because sometimes people have insurances that don't have a mobile service that can visit them at the community, and they don't have any care, or they're sitting there waiting until they get sick and call 911. I always hear this, no shade here against any particular health plan, but we have Kaiser, who's very, very popular in California. And so the communities will say, oh, they're not calling me back, or, oh, I've been on hold for 30 minutes with them. And I'm thinking, okay, so I don't know, that was a long-winded kind of story, but should people change their health plans at a certain time when they move into a community where they're being more homebound, or what are the options? Because I never know what to tell them. So that's why I have you here.
Yeah, well, that's a really great question. And unfortunately, people actually don't know until they're faced with a move in or they've been in a facility for a while, and all of a sudden, their level of care requires their visits to be more than normal. Maybe the adult, even though they're living in a community, maybe their loved one still actively took them to the physician or healthcare practitioner. And now that's not the case. The family is or person is they're not able to do that. And so most people, Dr. G, they have actually, I think this is very interesting, is that when they go on Medicare, whether they turn 65 or they retired and they get their required Medicare insurance, most people actually don't even know what they have. And so, really, there's two options. You can have original Medicare and you pay for a Medicare supplement. It allows you to go anywhere in the country or see any physician that takes original Medicare. And after they continue to pay that monthly bill and their Medicare Part B deductible, they have no other medical expenses. But in the early 2000s, Medicare Advantage was another option. And there is no monthly fee typically, but it is a managed HMO option. And so it requires the person to stay within that network. And unfortunately, when you do move into a community, most of those physicians do not do mobile care. And so that's usually where the roads cross, and the family cannot continue to take that patient to their in-network provider anymore. And now they're looking to get a mobile physician that comes to the facility or the community.
Let me ask a question, but before you go on, I don't mean to interrupt, but that's something that families seem to not know. Like as they are, they're moving their parents in, or maybe, you're one of the folks listening to this before you make the move yourself. Consider that you may need more help with your activities of daily living. Those things that we talk about, the 6 things you need to get out of the bed and to the breakfast table. As you need more help with those, obviously you can't easily get into a car and go across town to your medical appointments, and see the doctor that you've known for years. And you need to, in my opinion, bring all those services to you. And there are plenty mobile services out there that will visit, that will do referrals and things of that nature, whatever your goals of care are. Um, but again, you have to consider when it's time to have the doctor come to you instead of you going out of the community. Mobility is going to change, and then your insurance should also align with where you are in your trajectory of life.
Correct. And that is actually one of the biggest takeaways, is that most people that have, whether it's a concierge doctor or a mobile medical group, the majority of those mobile physicians, they only accept original Medicare with a Medicare supplement. There is a very limited amount of mobile providers that accept a Medicare Advantage plan. And it's typically a certain amount of insurance carriers that can be assigned for one of those physicians to be a mobile medical provider for them to be assigned under. And again, maybe someone's been with a certain health organization for 30, 40 years, and they're hesitant to switch because that's all they know. But unfortunately, their care is a lot higher level now, and it's really putting the patient and the community at risk because they can no longer make safe medical decisions, and they do critically need that mobile physician to come and visit them. So that is one of the things, and why a lot of facilities and communities, they will reach out to me, and I'll be able to kind of walk that family through what's important to them.
Mhm, mhm. Thank you for spelling that out. I know I was on a panel, I think a year or two ago, as a mobile concierge private pay, and then there were a few other local services. In San Diego, we have one called Pine Park, one in Southern California at Senior Docs. I think they both use PAs or NPs. I'm not absolutely sure. Then we have a couple individuals who serve the community. I heard they take Medicare Advantage. So the point is, when you are moving into a community, you need to make sure on day one that you have your insurance aligned. But I know they can't just change it on the fly. We see these commercials for open enrollment. When does this happen? When should they be working on these things or planning ahead?
Well, that's a great question. So there's a lot of people assume that you can only do it through open enrollment, but if someone is moving into a facility, or if you are currently living in an institutional setting, you have something called a special election period. And so, like it right now, it's July 16th. If someone calls me even on July 31st, uh, because they are requesting to switch, we can change them for an August 1st effective date. And if the Medicare Advantage plan is the mobile physician is in network with that insurance carrier that's a Medicare Advantage plan, then they can be under their network of care. And that is specifically, I will say, Pine Park. They are one of the only Medicare Advantage plans that do take the HMO option. Some others take a PPO, but now going forward in 2026, a lot of the Medicare Advantage PPOs are very, very limited, and many carriers have actually discontinued those plans, so people cannot switch to those.
I used to hear a lot about one called Scan. Is that seems like
Um,
the commercials were out for seniors, and I don't know.
sure.
I don't know about insurance.
Yes, no, that's a great question. So SCAN is, I think, believe the number one Medicare Advantage plan in all of California. They have a very happy policyholders. But unfortunately, if you're on SCAN, typically the mobile providers do not accept SCAN. They are not an in-network provider. And so, unfortunately, they're not going to be able to be seen with a mobile physician. And also, mobile blood work, mobile X-rays. Those are other services that also come to the building as well. So, and they have many of those mobile physicians are in the building at least weekly. So it is really a hands-on concierge option almost with a HMO insurance option. If again, depending on if the building has that provider access as well.
Mhm. Wow, that's a lot to think about. Hmm. I forgot to ask, for the sake of the audience, could you explain what the credentials in your name are? The CLTC, is that the insurance expertise there?
Sure. So I'm an independent Medicare specialist. I have a master's in business. And, funny as life is, I always wanted to work for a big organization. And funny thing is I work for myself. So it's just a one man band for me. The CLTC stands for Certified Long Term Care Specialist. And so I work in 30 different states and I help people really are educate and plan for their extended long-term care planning because Medicare doesn't cover any long-term care services. They'll cover 20 days of a skilled nursing facility and up to 100 days if you have a Medicare supplement. But as you know, Dr. G, the hospital typically doesn't keep a patient in the hospital, specifically a skilled nursing facility, up to 100 days. Uh, Usually, I've actually had a client call me and say, "Hey, you told me that I have 20 days of being in a skilled nursing facility." And I said, "Yes, your Medicare does cover you 20 days, but I'm not the physician. They're the ones that are determining if you are stable or maybe you're not stable and you're not going to improve."
See, these are the things that are so important. Um, Listeners, when someone goes into the hospital, it's important to know what diagnosis they're being admitted for. That determines the level of care. If they're going from the ER to the ICU, that's one level of care. If they're just going to med surge for a couple days, the different diseases or diagnoses have a predetermined length of stay that we treat them for, right? And so I don't want to get into the weeds too much, but this is another reason to consider having a healthcare roadmap because people, including people in my family, they can never tell me why is the person in the hospital for what? What are we treating? And listen to me. I really need you all to get with the program and understand that. Now, before we move on, I remember one thing I was going to ask. Could we kind of lay out the different kind of Medicares? Because I remember years ago I learned what Medicare Part A, Part B, Part C, Part D, and I think there's a G or something else. Could you tell us what that is? All I know is that hospice is in Part A and hospitalizations. That's all I know.
Well, and it's interesting. Many people actually don't know. They just know that, hey, I'm either taking Social Security or I'm not, but I'm retiring. And they told me I need to go on Medicare. So, Medicare is actually, they make it way more complicated than it should be. If you are a U.S. permanent citizen or you are a U.S. citizen and you've worked for 10 years, or if you've been married to someone who's been in this country for 10 years, you get a red, white, and blue Medicare card. And that shows your name, a random number, and it has a Part A and a Part B start date. And so it's really your Part A is your hospital insurance. So it's everything that happens inside the hospital. Okay, so hospice would be included, if skilled nursing facilities included, anything that happens inside. So that's Part A. That has a $0 premium because you've paid for this through your taxes, through your earnings, your entire life. Part B, as in boy, is everything that happens outside of the hospital. So your doctor's visits, MRIs, x-rays, even dialysis is considered Part B. Diabetics that have insulin, that need those the needles, test strips, that's actually even covered under Part B as in boy. But Medicare's not free completely. So Part B, that's what everybody pays for, even military veterans. The only people that don't pay for Medicare Part B are people who are low income on Medicare, Medicaid, or Medi-Cal in California. Okay. So every year, that monthly premium is either coming out of your Social Security benefits that you receive monthly, or if you're not drawing on Social Security, you can pay by check and you pay Social Security in the centers of Medicare and Medicaid. Okay. And every year that also increases. So once you have your red, white, and blue car, your Medicare A and Medicare B, it doesn't cover everything. Generally, Medicare covers 80% of hospital and outside of hospital services. So that's where you need to make a choice. Do I pay for a Medicare supplement and pay for a standalone drug plan? Or do I want to have something that's kind of an umbrella, meaning Part A, Part B, and they often call it Part C, which means dental, vision, sometimes transportation, all of those things. I mean, some plans even pay for groceries. That is included. And so those plans typically are $0. However, if you were to be hospitalized, typically they have a $300 copay for every day you've been admitted. So they're not completely $0, as a lot of people think. If they end up going to the hospital eventually, they have a very high copay for hospitalizations. And that is where a Part C typically is an HMO plan. They have to stay within the network, and you can only see with that medical provider and their medical group. So that's kind of the broken. I always tell people, choice A, you pay for a Medicare supplement. Choice B, you have an in-network medical provider and their medical group, and you don't pay any dollars unless you have co-pays based on their insurance plan. Does that make sense?
I'm about to test your students. So am I hearing seniors should have two things? They're going to get their Medicare. Well, one thing they should pay for. They're going to get their Medicare card, and they should pay for a supplemental insurance, like a Medicare Advantage plan. Is that it?
You're part right. If you're
Uh-oh.
going to go with a Medicare supplement, you pay for that. So if you think about it, you have to pay for Medicare. So that's one cost. In 2026, the monthly cost for Medicare is $202.90. Okay. That's a lot of money that's coming out of a fixed income. And so if you're choosing a Medicare supplement, which was choice A, you have to pay for a Medicare supplement. That cost, if you're 65, can start at about $125. Okay. Every year, those costs increase. So, for example, my mom, her Medicare supplement is about $332, and she's 74. So every year it does increase. So and that's not including prescriptions as well. You have to pay for a prescription drug plan and your medications. What's the trade-off? You can go to any physician that accepts original Medicare. You have no medical costs once you pay your deductible, which is in 2026. It is, I can't remember offhand, I believe it's $283. And so that's where you can say, wait, I don't have the funds to pay that every month. I'm going to stay with an in-network doctor and choose a Medicare Advantage plan. It is $0 because I'm already paying Social Security. And if I have a situation where I go to the hospital, if I get a colonoscopy, if I have to have an MRI, I'll pay the copay if I need it. But the reality is it's great when you're 65, but maybe at 75 or maybe 80 or later, you have other major medical concerns. And now we're at a point where you can't just go and say, hey, I'd like to go back to original Medicare, and they say I should get a Medicare supplement. You have to answer health questions to purchase a Medicare supplement. Some of those questions can be, have you been to an urgent care in the last 5 years? Have you been hospitalized? They don't, because it's private insurance. It is not a guarantee.
Whoa, this is so much to think about. It's scary. So I might sound silly or naive. Is it reasonable for adult children who are navigating this with their parents? Maybe they're moving their parents into memory care. Is it reasonable for them to switch them to pure Medicare and leave it at that? We're talking people in their 80s and 90s. That's kind of the demographic that I serve in the community. Is that realistic? Because I don't want to say things that are unrealistic because I'm no insurance expert. I just know what I'm seeing, boots on the ground as a physician, and what I'm hearing, when the family caregivers are in crisis and when they're trying to get things rolling. So I'm creating this so that they can think about these things and plan ahead or know how to navigate it if they're in the crisis. So is it realistic? Should they consider that when they're in that state of life, like 80s, 90s?
Well, you can always switch to original Medicare one time a year. But remember, Medicare doesn't cover everything. They typically cover about 80%. So if the person were to switch back to original Medicare and say, for example, had a emergency room visit and they were there for, let's say, 2 days, remember, it's everything outside of the hospital. So Medicare has a rule that if it's covered under Medicare A, which is hospital insurance, they need to satisfy 3 overnight stays to get that billed under Medicare Part A. So you could be responsible for 20% of the cost while you're in the ER room or ER to have, and you'd be responsible for. There is no limit of what they can bill. And that's why people choose a Medicare Advantage plan, because they have something called maximum out of pocket. It caps how much a policyholder or Medicare beneficiary will cap of what they can spend. Let's say, for example, if their max out of pocket is $3,500 for the year, well, then let's say they will not have to spend any more money on healthcare after they've met their maximum out of pocket. Original Medicare, there is no limit.
So then it seems like even if the Medicare Advantage plan doesn't have a mobile service, they should still keep it just in case. Is that accurate?
That is correct. But if you're living in a community, you're putting a lot of responsibility on your loved ones to continue to go to the physician, to their in-network physician.
Mm-hmm.
And so sometimes people have no choice. Maybe the mobile physicians like Pine Park Health, maybe they don't go to that board and care. Maybe the family or the board and care still needs to take that resident to their physician. So, and you have to health qualify for a Medicare supplement. So there's no way, especially if someone's in a memory care, they're not going to health qualify.
Wow. Sounds like a lot. And as we are having all of what is it? We had that quiz, 10,000 seniors a day. We had a quiz last week at our little event. Sounds like some of the RCFEs, it would be in their best interest to have medical directors maybe or something, because how are we going to manage? Like, how is this going to work? Because things
Yeah,
happen all the time.
well, that's interesting because I have the exact same situation that happened just recently, and I actually referred them to for your organization because the gentleman's wife had a massive stroke, and the wife was in the skilled nursing facility, and someone in the hospital said you should really go back to original Medicare. And I said, with all due respect, what happens when you take your wife home? She could be on the hook for 20% of her medical costs. And so those are really dangerous things to do because the people may not be in a position to pay 20% of all their medical costs. It's really unfortunate, and you don't know until you're faced with those decisions.
Right. Well, this was a lot. I know we can't answer all of the scenarios here, But the takeaway I have is think about this. Kristine is our valuable resource. Her organization, the link to her website will be here. And you need to, again, try to think about these things before you're in the crisis. So I'll leave you with the last words.
Oh, well, thank you. Well, as an adult caregiver myself, it's just important to have the conversations. Sometimes, especially with different generations, and I'm Filipino, so most people that families, they don't want to share information, but it's so critical because they're going to need your help, and if they need your help, you have to know the right decisions. And you want to work with someone who's independent, who is able to, you can run these situations by. And oftentimes, families often think of price, but I let families know, are you in a position to take them to the medical provider every week? And if you're not, maybe this is a time to make a change. Uh, I know there's many, many resources out there. Dr. G, what you do is so important. And I'm truly blessed to be able to do this. And if I can't help them, I certainly will point them in the right direction.
Yeah, well, thank you so much. That's why we're here to help people. And, I love your motto on the Giving Tree Insurance website, planning and protecting your health and legacy. Kristine is an independent insurance agency dedicated to secure coverage plans that best fit your health needs and future legacy. So thank you for all that you do, and thank you for everything you taught us today.
My pleasure. All the best.
All right. Well, signing out. Peace, everyone.